Welcome, doctors, to our PLAB 2 preparation series. Please like and subscribe to TuringMedSchool. Good luck with your preparation. Today, we will explore managing depression within the UK, focusing on the holistic approach used in the NHS. This approach combines medical, psychological, and social interventions. The primary goal is to alleviate symptoms, restore functioning, and prevent relapse. You'll use medications, psychological therapies, and NHS community resources to support your patients. Familiarize yourself with the UK's NHS pathways to navigate care effectively. Pharmacological treatments start with antidepressants. SSRIs like sertraline, citalopram, and fluoxetine are first-line treatments for moderate to severe depression. SNRIs like venlafaxine and tricyclic antidepressants such as amitriptyline are alternatives. Always follow NICE guidelines and monitor for side effects. When offering medication, use patient-centered communication. For example, you could say, based on how you're feeling, starting an SSRI could help. Would you like to discuss this option? Ensure informed consent and document the conversation thoroughly. Once medication starts, set expectations. It may take 4 to 6 weeks for full effect. Discuss possible side effects like nausea or headaches and stress adherence. You might say, it's important to take this daily. Let's review how to manage any side effects. Psychological therapies such as cognitive behavioral therapy or CBT and interpersonal therapy or IPT play an essential role. CBT targets negative thought patterns, while IPT focuses on relationship issues. Mindfulness-based cognitive therapy, or MBCT, combines mindfulness with cognitive therapy. When introducing therapy, say, CBT has helped many people with depression. Shall we arrange this for you? Be culturally sensitive, offering interpretation services if needed. Self-help resources such as guided workbooks and online CBT can also empower patients. You might suggest, there are self-help tools you can explore at your own pace. Would you like to try them? Next, we'll delve into social support and lifestyle changes, key components in the holistic management of depression. Support groups are an excellent way for patients to connect with others who share similar experiences, which can foster a sense of belonging. Exercise and physical activity are proven to improve mood and reduce symptoms of depression. Even light physical activity can make a big difference. You could suggest, incorporating regular exercise can really help. How do you feel about starting some light physical activity? Encouraging a healthy diet is also important for overall well-being. Nutritional support can positively impact both physical and mental health, so it's worth discussing with your patients. Next, let's talk about crisis planning, a vital part of managing depression. A personalized crisis plan outlines the steps a patient can take if their symptoms worsen. This plan should include coping strategies and emergency contacts, ensuring the patient knows what to do in a difficult moment. You can offer this by saying, let's create a crisis plan together so you know what to do if you're feeling worse. Another useful tool is a crisis card. This small card contains key information like emergency contacts and is easy to carry. This can be especially helpful in times of distress. Now, let's delve into creating a detailed crisis plan. The plan should identify personal triggers, warning signs, and effective coping strategies. It's essential to work collaboratively with your patient to tailor the plan to their needs. For instance, you could say, having a plan can make a big difference if things get tough. Let's work on this together. If a crisis does arise, there are various support services available. The Samaritans offer emotional support anytime by calling 116-123, and Shout provides crisis support via text. Just send Shout to 85258. NHS 111 can provide urgent medical advice, and crisis resolution and home treatment teams offer intensive support at home. You could inform the patient by saying, these services are available 24/7. Please don't hesitate to reach out. Additionally, community and online resources can offer continuous support. Charities like Mind and Rethink Mental Illness provide information and support, while NHS Every Mind Matters offers mental well-being tips. For online communities, Togetherall is an excellent platform for emotional support. To offer these, you could say, there are organizations like Mind that offer great support. Would you like their contact information? For patients experiencing work-related stress, occupational support can make a huge difference. Workplace adjustments like flexible hours or remote working can be explored. If time off is needed, Fit Notes, also known as Sick Notes, can be provided, and the Access to Work program offers government support for those struggling with mental health at work. You can start this conversation by asking, if work is contributing to your stress, we can consider adjustments or time off. How does that sound? Financial and social concerns can also affect mental health. Offering benefits, advice, housing assistance, or social care services can help ease these burdens. Ask your patient, are financial or housing concerns affecting you? We can connect you with services that might help. Following up and monitoring progress is essential in depression management. Regular appointments allow you to review treatment and adjust if necessary. Monitoring side effects, especially in the first few weeks of treatment, is crucial. You might say, I'd like to see you again in 2 weeks to check on your progress. Is that okay with you? Relapse prevention is a key focus. Educating patients on recognizing early warning signs and developing coping strategies is important for long-term well-being. You can discuss this by saying, let's talk about ways to maintain your well-being and prevent future episodes. Let's now consider the role of family and carers in managing depression. Involving a trusted support network can significantly improve a patient's care experience. Carers should be educated on understanding depression and how they can offer help. However, this involvement should always be with the patient's consent, respecting their confidentiality. You could say, would you like a family member or friend to be involved in your care for additional support? Next, we explore additional therapies and supports that complement traditional treatments. Mindfulness and relaxation techniques, such as meditation or deep breathing exercises, are often beneficial for patients. Arts and creative therapies offer another outlet, allowing individuals to express their feelings through creativity. Some may also benefit from complementary therapies like acupuncture or yoga. To introduce this, you could ask, some people find mindfulness or creative activities helpful. Is this something you'd like to try? Addressing substance use is crucial when assessing a patient's mental health. Alcohol or drug misuse can often exacerbate symptoms of depression. Assessing these habits and, if needed, referring the patient to specialist services is essential. You might open the conversation with, sometimes alcohol or drugs can affect mood. Do you think this is an area we should look into? Always approach these discussions with a non-judgmental and supportive tone. When providing care, it's important to offer culturally sensitive support. This means understanding and respecting the diverse backgrounds of your patients. Interpreting services can also ensure that patients receive information in their preferred language, aiding understanding and comfort. You could offer this by saying, we can provide materials and support in your preferred language to make things easier for you. It's vital to comply with UK regulations on equality and diversity, ensuring inclusive care for all patients. Understanding legal rights and advocacy is another essential part of managing depression in the UK. Patients have rights to care, confidentiality, and informed consent. If they ever feel uncertain, advocacy services can help navigate the healthcare system. You could provide this information by saying, if you ever feel unsure about your rights or need support, there are advocacy services available to help. For those needing compulsory treatment, ensure they understand the Mental Health Act and their rights under it. As we come to the end of today's consultation, it's important to summarize the actions agreed upon. This may include medications, therapies, and follow-up appointments. Provide encouragement, letting the patient know you are there for ongoing support. Offering written information such as leaflets or contact details can also be helpful. For instance, you could say, we've covered a lot today. Remember, we're here to support you. Please reach out if you have any questions or concerns. Finally, it's essential to tailor each care plan to the patient's unique needs, ensuring a patient-centered approach. Consider any cultural factors that might influence care, and always maintain patient confidentiality in line with UK regulations. As healthcare professionals, it's our responsibility to stay informed about legal obligations and ethical practices, ensuring the best care for our patients. Thank you for joining this series on managing depression in the UK. By combining these approaches, from medical treatments to social support, we can offer holistic, compassionate care that truly makes a difference in our patients' lives. Stay connected with your patients, be available, and always strive to provide support tailored to their needs. Please like and subscribe to TuringMedSchool. Good luck with your preparation.